Hello, everybody. Welcome back to Above Average. This is a very exciting episode. This is season 2, episode 1, and I am solo. So we're bringing Above Average back, but just with Larissa Violet. And we have a very exciting guest today who, when I was reading about him, completely embodies what I think of as above average. And I'm so excited to introduce Dr. Juan Rendon. Thank you so much for being here today.
Thank you so much for having me. This is great.
I'm so excited.
Yeah, me too.
Okay, so I want to jump into who you are. Mm-hmm. I want to highlight a few things that stood out to me. When I was reading about you, you have a doctorate and a PhD, right? So, which is not common.
It's not common at all. I'm one of few doctors in the country, never mind maybe less than 10 plastic surgeons in the country that have both a medical degree, a doctorate of medicine, and then a PhD, which is a doctorate of philosophy. And so my PhD was in cell biology, really nerdy stuff like cell biology.
I like the nerdy stuff.
Wound healing, that sort of stuff.
Okay. Yeah. And then how did that turn into plastic surgery?
So the way that MD PhD stuff works is you do 2 years of med school.
Okay.
And then you do some period of a PhD, somewhere between 3 and 5 years of a PhD time. And then you go back and finish out your 2 last years of med school.
Okay.
I did that. I did the 2 years of med school. I joined a wound healing lab in the Department of Surgery in med school.
Okay.
And it was in the Department of Surgery. And the reason that's important is I was working with all surgeons, like a bunch of residents, other people, but we were focused on wound healing. And at the time, I thought that I wanted to pursue an academic career. Work at UCLA, work at Stanford, work at some like high-end university.
I was going to say, what does that mean?
Yeah, it means to like work at a university.
Yeah.
I was going to do research and I was going to have a clinical practice. And I had this like great vision in my mind of where I wanted to be in 10 years.
Okay.
And plastic surgery lent itself really well because it offered the ability for a clinical practice. Mm-hmm. It also lent itself for some research. Mm-hmm. As time went on, though, I quickly realized you can't actually do it all well. And you sort of have to decide what you want to be better at. And I ultimately wanted to be a better clinician. So I stepped away from the idea of an academic career.
Okay, got it. And then where was your start in plastic surgery? Like, how does that start? You don't start your own practice. You don't just like jump out and you're just like cutting people open. Like, how does this start?
It's so complicated. So I did 6 years of plastic surgery residency.
Okay.
And then I did a year of advanced fellowship in what we call microsurgery.
Okay.
It's I specialize, part of my practice is heavily specialized in breast reconstruction after breast cancer. And after mastectomies.
Okay.
And there's a very specific surgery that I do that requires like sewing 2-millimeter vessels together. Wow. And that's where the microsurgery comes in.
Yeah. Okay.
So when I was finishing up training, I toyed with the idea of moving to Chicago, moving to Washington, D.C., moving to like up in Palo Alto. And ultimately, I'm from LA. I grew up in the Valley, and I knew that deep down I wanted to come home. And so I interviewed for a couple of jobs in LA.
Where were you at this point?
I was in Pennsylvania. I was at the University of Pennsylvania.
Oh, okay.
I was in fellowship.
Okay.
So I was living in Philly, and it was right in the peak of the pandemic. So you couldn't actually fly to an interview. Like a lot of the interviews were either on Zoom or they were phone calls. It was just it wasn't a normal time for getting a job. Mm-hmm. Also, institutions and practices were either hiring because they were super busy or not hiring at all because they were not busy at all or they were unsure about where the practice was going to go.
I was going to say, were people doing plastic surgery during COVID? Someone's like, give me that BBL.
Probably not in 2020, but beginning like the spring of 21, it was a big surge for plastic surgery.
Okay.
Like suddenly everybody was working from home.
Yeah.
There was some of the stimulus money that was coming around. And so all of a sudden there was a lot of surge in elective plastic surgery.
Okay.
And that's right around when I was looking for a job. And so I interviewed for a job with a cancer center here in California, and they wanted to grow into the community that I currently work in. And so when I interviewed with them, I frankly asked them, like, who's already doing the work that you want me to do? And they gave me the name of the practice that I eventually joined, South Bay Plastic Surgeons.
Wow.
So I emailed South Bay Plastic Surgeons on a whim. I just, through a friend of a friend, got the email from one of the guys, and I said, I'm from LA. Here's my training. Here's my CV. This is what I think I can offer. I'd like to live in LA. Are you willing? Are you hiring?
Yeah.
And weeks went by. I was like, oh, they basically told me to fly a kite.
Yeah.
And no, then they emailed back and was like, well, we're not actually hiring, but we're happy to, we're always happy to talk to someone and see if it's a good fit. So I flew to LA.
Okay.
I met with them. And a couple of weeks later, they're like, we if you want to join us, we'd be happy to have you on.
Yeah.
And then I joined him and it's been perfect.
And when was this? What year is this?
It was May of 2021 when I initially reached out, and it was October of 2021 when I joined him.
Okay, so you're going on like 5 years.
Yeah, I'm about at the 5-year mark.
Yeah. You said something interesting that I've literally never thought of before. You said elective plastic surgery. So there are plastic surgeons that focus on like medical emergency or necessary plastic surgery.
Medically necessary is a better word. Medical necessary is for things like breast cancer.
Okay.
Lacerations.
Yes.
I know you have kids.
Yes.
So, kids get cut all the time. They fall on things. And so when you take them to the ER, it's considered medically necessary to fix your kid's laceration.
And that's considered plastic surgery.
And some people will request a plastic surgeon. Some lacerations are complex enough where they're like stellite or they're just broken enough or something is missing that the person in the ER doesn't feel comfortable just putting it together, and they bring us on. So I take call at 2 hospitals where I have to get called in every so often.
You do that?
Yeah, I take call at 2 hospitals where I occasionally have to go into, usually a child, usually fell, usually a boy. There's always
oh my gosh, of course. I know. As I'm thinking about my 2 sons at home right now. That is crazy. It's never even crossed my mind. But now that you say it, it's like, duh, obviously.
It makes sense.
Yeah, it makes
And then there's always
sense.
the breast cancer mastectomy patients.
Yes. Okay. I mean, that one makes sense to me. Like that. But the others, you said elective. I'm like, duh, there's
medically necessary
plastic surgery. Wow, that's really interesting. Okay. So you've been there for 5 years. So you said your specialty obviously is breast reconstruction. What else are you known for?
So about 80% of what I do is breast surgery of some kind.
Okay.
And so that includes breast reconstruction after mastectomy. It includes breast lifts for cosmetic patients, breast augmentations, breast reductions.
Okay.
Some sort of breast surgery is about 70 to 80% of my practice.
Okay.
The rest of it is some facelifts is actually my favorite surgery.
Really?
But no one's looking. Usually the people that are known for facelifts are a little older. So it's not like people are coming to me right now in my career for like a facelift all the time.
Okay,
but
let's
it
talk
is my
about
favorite
the facelift
surgery.
thing right now. We'll go back to the breast. Let's start with the facelift. So I am very weary of filler and Botox. Okay? It's just not my thing.
Sure.
I'm very open about this. If it's your jam, great. We've had 2 gals in the past who have med spas and they talk about filler and Botox, and I'm like, it's just not my thing. I don't want to have my face injected. And then I kind of was thinking, I think the reason why is because I like my face and I don't want it to be altered. So I said to someone this morning, I'm like, I'm more inclined to do a facelift at a young age than I am to get filler. Is that weird? Or is that
not that weird.
Coming about?
It's actually the newer thing.
Is to do more like little
there
tucks
is this
and things.
idea that a couple of years ago, there was the idea of a 40-year-old facelift.
Okay.
Okay. So there's this idea that if you're in your 40s, low 50s, you do a minor facelift, like a mini.
Okay.
And everybody's definition of a mini is different. But if you do sort of a minor tuck in the earlier age, it will actually buy you a long time in the long run. So you don't truly need a full facelift.
Like a full Kris Jenner thing. Okay. And that's like around 40.
Somewhere, it's getting younger and younger, but somewhere between 40 and 55. The average age of a facelift in this country used to be around 52. It is much closer to 40 now because there are so many more women that want to do it earlier. And some of them are people that are regularly doing the Botox, the fillers. Some of them have never done anything. And they've just decided they don't like the jowling. They don't like their neck. There's something that's bothering them structurally that's never going to get better with a non-surgical. And so they just jump in and they do the facelift.
Got it. Okay. Because I think about that too. Obviously, I just turned 35. And
You're so young.
I know. No, I am so young. And I know. And also my mom's Hispanic. So I feel like
I'm Hispanic. Yeah.
So she doesn't do anything and she looks amazing. But she just did the bleph. And so I feel like eventually she'll do other little lifts. But the thing is, I think for both of us, I know she would say the same, is we almost are we don't want to change our face. It's not even about changing. It's not don't add filler to add a cheek or add here. We just want the lift, but having a facelift kind of sounds crazy.
Yeah.
Yeah.
Mind you, I've done a facelift on a 29-year-old.
I was going to ask, what's the youngest facelift?
But that's somebody that had lost 100 pounds. And so, when you lose a tremendous amount of weight, you have what we call accelerated facial aging.
Yeah.
Things just kind of fall. And then I have my little spiel that I give all my patients about faces and aging. But there are a lot of people that just don't like the sagginess, the droopiness,
Yeah.
things that are starting to fall with time.
What's the youngest person that's come in asking for a facelift?
Probably that 29-year-old.
Was it 29?
Yeah.
But that's a good case for it.
That's a great case. I
And
have
would you
also
decline
had,
somebody if
I
they
was going
were-
to say, I've also had somebody who was around my age. So I'm 42. I had somebody probably when I was 40 that was 40 who had very, very little like neck banding and just very, very little jowling. And I said, I just don't know that the scar that I'm going to put on your face is worth the benefit of a little tuck, of this small of a tuck. And if you ask 5 plastic surgeons, probably 2 or 3 of them might say yes, but I just don't know that the risk and the scar is worth your time right now.
So I'm glad you said that, because you also said something interesting earlier about like when you were going through your schooling and residency and all that, and you said that you had a focus in scar and wound healing. And I would imagine most plastic surgeons don't have that. Is that like a very specialized thing?
It's an extra attention thing. So I was funded by the NIH to study scars at one point.
Okay.
And so I am very interested in scars and the way people heal. And the reality is we all heal a little different. Like, in a perfect world, any surgical scar we create is going to heal thin. And in about a year's time is going to seem almost invisible or camouflage with the rest of the surrounding skin. That's not the case for everybody. Sometimes the scar gets really wide. Sometimes it gets really thick. Sometimes it looks raised. Sometimes it looks red. And so those were the sort of things that interested me when I was like doing research. And the reality is we don't have a predictable way to know how you're going to scar.
Yeah.
We have some stuff to improve scarring, but we don't have anything that's truly going to make your scar perfect no matter what you do, what you buy, what you pay for. And so I think I personally think very strongly about what is the scar that we're putting on your body worth the benefit of whatever we're trying to accomplish.
I think that is so important and such an interesting and unique benefit that you bring.
Well, thanks.
Because I don't think most doctors would be thinking about
Like
that,
I said, and that's
right?
why I tell
like they're
all my
just kind
patients,
of like, you're going to
I
have
say-
a nice tummy, but we're not going to talk about the scar or
Exactly.
whatever.
And I hate when the patients tell me that. They're like, well, no one else told me about the scar. I was like, well, I wish somebody had, because now you're trading whatever you don't want for a scar of some kind.
Yes. Okay. So I have, talking about the scarring, I just had 3 babies back to back. They're super little. I've always been super petite. And so then I had these gigantic babies, and there is like,
How much did your babies weigh?
all 3 were 8 pounds.
Oh, yeah.
And
Okay.
all 3 came early and like very early. So they would have been
10.
big. Yeah. And with my first son, I gained 80 pounds.
80?
80 pounds.
I can't even imagine you with 80 more pounds.
I started out like 100, 105.
Oh my God.
And I gave birth at like I'll maybe call it 75 pounds to be fair. I think I gave birth at like 175.
Oh
it
my
was
God.
insane. Yeah, I know. And then I had 2 more babies after that.
Sure.
So everyone's like, oh, your stomach will go back. I'm like, no, you don't understand. It is like so much extra skin. And like, I wish I could show you right now. And so it's going to have to get surgically done.
So I tell patients this. I tell them, because I treat a lot of moms. So what I say to moms is when you were pregnant or when you were before pregnancy, your 6-pack muscles were touching each other.
Okay.
And when you got pregnant, they stretched out to accommodate for the baby.
And that's when you get that
So it's got separated. And then you gave birth and they came back, but they didn't come back all the way.
Okay.
They came back, call it 70% of the way, 80% of the way. And for someone like you that had multiple children, then they went back again. And then they came back again, but not as close this time. And then again. And so and that's what creates what we call the rectus diastasis, or that separation of the muscles in the middle that then allows your guts, or your intestines, for lack of better words, to kind of push through and create some roundness.
Yeah.
So even though somebody may in their 20s have done Pilates and had a 6-pack, all of a sudden they feel like they have a little, not a bulge, but like a round character to their abdomen.
Yeah, that's me.
And that doesn't account for even the skin. So usually the issues are twofold. It's one, it's the muscle separation, and then 2 is the skin. When you're really young, you can have a child and then kind of snap back. But every time you're snapping back just a little less, and every time you're getting re-stretched out. So those sort of situations are only going to ever be addressed with surgery. And there's all sorts of non-surgicals that you could try, but at the end of the day, nothing is ever going to substitute surgery and excision of that skin and true repair of those muscles.
So you're repairing the muscles and you're putting the skin back. You're obviously reshaping my belly button because my belly button looks crazy, right?
I tell everybody that your belly button is your belly button, and it's going to be the same one after the surgery, except it's coming out through a new little window. So we create a new slit. But your actual umbilicus is attached. It's part of your abdominal wall. It is there. We simply create a new opening for it to try to reshape it, to try to make it a little more youthful.
Got it.
And we try to put it, in a appeasing position. So a little
location,
high, not very low. You know, there's all these things that we try to do to try to make it nice.
And where's the scar for that?
For your tummy tuck?
Yes.
It's a hip to hip scar.
Okay.
Hip to hip. So did you have C-sections? Is that too much? No. Okay. So most women, it'll be about 6 centimeters, maybe 6.5 centimeters above your vagina, essentially. So it's very low, below your bikini line.
Okay.
Below your bikini line, but it does stretch hip to hip.
Got it.
And if you scar well, if it's thoughtfully placed, it can hide in most bathing suits. Not all, but it can hide in a bathing suit.
Yeah. And what happens if, or is this even, I mean, I'm sure it happens all the time. You get a tummy tuck, you get pregnant again, have another baby.
It does happen all the time. It's, we recommend, I have a couple of rules. So one of them is you should really wait till you're done having children to come in for a tummy tuck consult. Not because you're going to destroy my surgery or destroy your body, but because you're going to get recurrence of the issues we just fixed and you're going to have to do it again if you really want a perfect result. Mm-hmm. So you can have children. It has been scientifically shown that it is safe to have children after a tummy tuck. It does happen, but the rectus-diastasis can recur and the excess tissue and skin can recur. So typically I recommend patients wait till they're done having children and wait till their weight is stable for 3 to 6 months. Because so many people want to come in 6 weeks after.
I'm still losing weight a year later.
You might be losing weight. Some of your skin might be trying to stretch, to retract back a little bit. So it is beneficial to wait till you are completely stable for about 3 to 6 months.
Okay. And I just really need to decide. I tell my husband every day, it's either a 4th kid or a tummy tuck.
You're like, it's now or never, guys.
It's now or never. Because I'm ready to get, But we have a couple of friends who are like, we got the tummy tuck and then we had a whoops baby.
Yeah,
and
it happens.
It happens.
And I wouldn't worry about it. Nature will take care of it. Like you're not going to harm either the baby or yourself. It'll just possibly re-stretch out, but you're not going to medically harm yourself.
Okay. Yeah. Okay. So that's a conversation I need to come in for that.
Yeah. Absolutely. Any day.
Because it's people, I feel like, and some people are blessed. They do go back, and it's so great. And I see moms out there like, I had 4 babies, and everything was great. And then there's people like us. I actually just went yesterday to pelvic floor therapy, which we only talked about the core. And she's like, yeah, your abs are...
Yeah, they're way out there.
And it's just like, I don't know if any more Pilates is going to do this, or any more lasers on the tummy is going to...
That's the answer that I tell everybody. I was like, listen, if it's been a year, and you are an athletic person and you're doing, you're doing all the things, you're drinking the protein, you are going to the Pilates, you're doing the core exercises, this is probably it. This is as good as it's going to get before your tummy tuck.
And it's not good. So I'm gonna be in the office soon. Okay. I'm going to go through some of these, but we've kind of already covered a lot of them. I want to know, what is one thing that people are doing, whether to their face or body, that you wish they would not do? Like, you're having to correct these. Like, is it over filler? Is it the BBLs? Like, is there anything right now that's like super trending that you think is a bad choice?
I think right now we're in an era where a lot of people are dissolving their filler. Or reducing the amount of filler they're using. And I think it's a good thing, because I think we're going back towards a more natural appearance. Because I think there was a period of time where we were just maybe all overfilling people a little bit. So from the face, I am not a huge fan of something called Sculptra.
Oh, yes.
I'm not a huge fan. It's okay in the right time, in the right patient.
Is that the collagen boosting thing?
What we call a biostimulator.
Biostimulator,
it's a biostimulator. Yes. So it tells your body to produce collagen.
Okay.
A surgical scar, when you fall, when your kids fall, is collagen. So there are different types of collagen, but by definition, any scar is collagen. So we can kind of say that a biostimulator induces collagen, or induces scar formation inside your face. And so I was saying, facelifts are my favorite surgery. It 100% makes the facelift more difficult.
The Sculptra.
Mind you, I'm a microsurgeon. I can do the facelift. I can sew a 1 millimeter vessel together. I can do your facelift after Sculptra. It is just not fun. And it's not easy. It makes the procedure more challenging.
Got it. Okay.
Because you have your skin, you have a little layer of fat, and then you have what we call the SMAS, or the muscle layer that contains all the muscles that allow us to animate and all the nerves that control it. In someone that has had a lot of Sculptra, you have that skin. The fat is now tethered to the SMAS through that collagen. So it's like a sheet, just think of a sheet of scar tissue over where it shouldn't belong.
Yes.
And so it creates a situation where the dissection to separate everything and kind of rearrange everything, much harder.
It's interesting that you say that because I just went in for fascia work and he always works on the back for me. I mean, the stomach as well, but there's a specific spot for my second baby where I had the epidural and he's like, there's like collagen buildup here that scar tissue. But he's like, it's just, it's essentially collagen. So that's funny that you say that because that makes so much sense.
All scar is
and I think we think collagen is like, oh, we need
of course,
more,
and
more,
you
more,
do,
more.
and you do need it. But again, there are different types of collagen, and ultimately, every scar is made of collagen tissue.
See, this is why I like that you have the scar and wound background too, because this is very.
Well, thanks.
I like this. Okay.
And surgically, I'm not a huge fan of BBLs. I'm not a huge fan.
Okay, tell me why. That was going to be my question.
I was going to say, you asked me about
let's go with
So let's
BBL.
go back. BBLs. I think in the right person, they're good to add a little bit of volume where you've never had volume. I think they're good to minimize or try to reduce how much of a hip dip somebody has. But I'm not.
What? This is me. Sorry if everyone knows this, but I just don't. What's happening? Are you injecting something? Are you putting fat in there?
So what is it? So a BBL.
What even is it?
By definition, is essentially it's essentially trying to increase the size projection of your butt.
Yeah.
With some injectable, whether it's your own fat through liposuction.
Okay.
Whether it's a filler, some people will use the fillers, the standard filler. Some people will put Sculptra in there. Or whether it's off-the-shelf cadaver fat that is now available. So there's a bunch of companies that now create all sorts of products that we can use. And I think for the most part, they're safe. I just don't love the procedure in and of itself. I will do it if I think it's the right candidate, if they're the right size, if I think they have enough fat, if I think they understand, the off-the-shelf component of it.
Yeah.
The patient has to truly have informed consent. Okay. And then if they do, and they're a good candidate, I will do it, but it's not my favorite surgery.
Okay.
Part of the reason is if you think of somebody's butt, it's a pretty large surface area.
Yeah.
And so if you take this, for example, this is like, I don't even know how many milliliters, but this in somebody's butt is not going to actually do that much because it's going to disperse everywhere.
Yeah.
But off the shelf fat for this amount could be, I don't know, $15,000, $20,000.
Wow.
For just this amount. And so now if you're buying this for each side, you are spending a ton of money and you're hoping it all settles and sits well and integrates and doesn't cause any problems.
Yeah.
If it's your own fat and you're already a petite person that works out a lot, you probably don't have a lot of fat. And so again, we're going to put you under, we're going to do the liposuction, we're going to put the fat in, and then some of it's going to go away, some of it's going to take. And so I think there's a lot of things that have to go right for a good result.
Yeah, for it to be really good.
Yeah.
And is that why we're starting to see, not starting, I feel like it's been going on, like the lumpy butts?
Yes, correct. Because so if you use your own fat, in the best case scenario, so the way fat grafting works or, injecting fat is we take the fat, everybody washes it in different ways. There's all sorts of systems made to like take the fat and process it. And then we inject it back into you. That fat got disconnected from its blood supply, if that makes sense, because it was in a canister.
Okay.
We took it, we put it in a canister. Now it's disconnected from all blood supply. It has no nourishment.
Is it
except
dead?
air. It's not dead.
Okay.
So it's just alive enough that we're injecting it back in you, and hopefully it grabs onto a blood vessel and starts to pick up some nutrients and grows a new root and becomes a healthy blood cell.
But does that happen? Does it not happen all the time?
That probably happens to about half to 70% of the fat that gets put in. The other, 25 to 50% of the fat will either melt and your body will absorb it. That's actually best case scenario. It just kind of melts and your body picks it up.
Yeah.
Worst case scenario, if it's put in incorrectly and it's put in clumps, that clump could just die and now creates a ball or like a what we call fat necrosis, where it's just, you can feel it, you can see it.
Yeah.
Sometimes it's painful. Or you create like an oil cyst. So same thing. It's just like a little encapsulated piece of oil.
This sounds not worth the
and
butt.
so
I'm just going to say.
I'm not a big fan.
Okay. So the people who you've done this on, like they really, really needed it?
I admittedly have probably done less than 10 in my career.
Okay.
And probably 6 of them are extremely happy. And then there's probably 4 that didn't complain, but I don't love the way it looks.
I appreciate you admitting that.
You know what I mean? There's probably like 4 that I look at, I'm like, I see the lump. I see the bump.
Mm-hmm.
And it doesn't bother them per se, but it bothers me. I'm like,
you're like,
what do we do here?
Yeah. So then so let's move up to the breasts. Because we're on the topic of the fat transfer, I've kind of always thought, like I would love to get my breasts lifted because I've had 3 babies. I'm not interested in an implant. It's just not, I have like petite shoulders and arms.
Sure.
This is not like, I don't know, visually I don't think that's for me. But fat transfer to the boobs, I would think same thing.
So same thing. So there's a couple of things that I tell everybody about this. This I do a little more often.
Okay.
So we have been doing fat grafting a long time in the breast because of reconstruction. So people that need a little additional fat.
Okay.
Okay. My thoughts about it. If you're doing it for elective reasons, I think the lift is a great surgery. So what we do in a lift is with aging, with breastfeeding, with childbearing, your breasts tend to deflate. And then the skin gets stretched out and things kind of droop.
Yeah.
So the goal of a breast lift is to raise your nipple position back to where it belongs.
Yeah.
And to remove the extra skin, typically skin, and rewrap your breast in a better, more youthful place.
Okay.
That doesn't add volume in any way. It's not going to give you your upper pole fullness. It's not going to give you anything that you don't have. It's just going to lift you up. In fact, I tell patients, if you get the lift alone, you're probably going to look the same that you do now in a bra, because the bra is already lifting you up, if that makes sense.
Okay.
You're not going to be bigger.
Yeah.
Now, can we add fat in there to add volume, to add a little bit of projection? Absolutely. The thing is, so I explained that like half the fat will take, 70% of the fat will take, and then some of it will disappear, some of it will become an oil cyst. Women get breast cancer, and that's usually seen through mammograms and calcifications. And so a piece of fat necrosis or dead fat is going to come out on a mammogram as as a calcification. Not bad, but if you can tolerate the idea of getting a mammogram and having a calcification and having to wait to possibly get an ultrasound or get a biopsy, and it's not going to make you too anxious to worry about what it might be, I think it's a great procedure to do the fat grafting. But if you're a very anxious person and you're going to be really wound up by the idea that there's a lump, it could be anything, I'm dying.
Yes.
That's probably not the best procedure for you.
Not healthy for you.
Yeah.
No, got it. Okay. Very interesting. So with the lift, so I'll be coming in for the lift. When we talk about the nipple and putting it back in place, I've always read there's so many different places where the scar, well, I guess maybe not even specific to the nipple, but some people have the scar in the nipple. Some of it's like underneath, some it's a straight line. Yeah. How are people determining, or how are you determining like where that scar goes?
There are 3 main ways to do a lift. One is to do what we call a donut lift, where we basically take a rim of tissue all the way around your areola and then just kind of shrink everything down.
Okay.
Probably a good procedure for somebody that just needs a little lift.
Okay.
Like a very little lift. Then there's a lollipop lift, where the scar goes around the areola, but then all the way down to the bottom of your breast.
Okay.
That is also probably good for a small proportion of patients, because what it's doing is it's allowing us to lift, but then kind of narrow your breast a little bit.
Okay.
What it's not addressing is the distance between your nipple and the bottom of your breast. Meaning if you're really droopy, just imagine like there's a long distance, and we're not really addressing that. Mm-hmm. And then there's the anchor lift, which goes all the way around your areola, down to the bottom and across. Mm-hmm. I think that's the best option for most women, because that truly allows us to remove the extra tissue in both the up and down and the side to side direction, if that makes sense. So if we're able to get a better shape, a better nipple position, I think in general you get a better result.
But the bigger scar.
But the additional scar is really that bottom one.
Okay.
Who really cares about that one? Most people don't want to see the one that goes up and down, and that's not, you don't really ever get to skip that one.
That's
it's really,
just
it's
there.
really
That's
there that
just
like,
happening.
it's really rare that you get to skip that one.
Okay.
I don't see a lot of benefit in skipping the one across.
Yeah, it doesn't really matter. I mean, it's always gonna,
It's always gonna hide.
Yeah. Okay. Interesting. I'm learning so much. I want, because it just got asked, any thoughts that you have on the use of GLP-1s and Ozempic, and then is that kind of like causing a wave of body contouring? Are you seeing a shift in what you're doing or what patients are asking for because of that?
There's a couple. So we offer a medical weight loss program, actually. So I prescribe all three of the.
Oh, you do?
Yeah, all three of the GLPs right now.
Okay.
I think in general, plastic surgery is best done when you're at a stable weight and when you're happy with your weight. There are people, and we use all sorts of guidelines. One of them is a BMI. It's basically a calculation of your height and weight.
Yeah.
And there are healthy BMIs and unhealthy BMIs. Is it perfect? Absolutely not. But it's a good measure.
Got it.
And there are patients that want surgery that have too high of a BMI to make the risk of surgery worth the benefit of their want.
So you would recommend weight loss
first,
then doing plastic surgery.
And now I've had a series of series of patients that have come into me for a cosmetic consult where I've recommended weight loss first. They go on their weight loss journey, takes 6 months, a year, and then they come back for their actual surgery. And now I think they have a much better result. I also think they're in a much healthier position in life.
Makes sense.
And I feel like they feel better.
Yeah. No, that's great. And then what about, this is a crazy question. I was going to ask if the BMI is too low. Are you saying like we need a little more to work with? I don't know. I'm just curious.
For GLPs, I definitely say no to some people if they're too low. Like if the BMI is too low, I was like, listen.
Yeah. Like
what are we accomplishing here? I think you need to see somebody else.
Yeah. Okay. That makes sense. And then when someone comes, because a lot of my followers are moms, when someone comes in for a mommy makeover, is that really at the, like you and her are saying like, what do you not like? And then you're kind of going from there?
I think everyone's consultation is a little different. But the way I define a mommy makeover is combining in one surgery some kind of breast procedure and some kind of tummy procedure.
Got it.
That's typically a mommy makeover.
Okay.
The breast procedure could be an augmentation with implants. It could be fat grafting. It could be a lift, or it could be a reduction. And the tummy procedure could be anything as simple as just liposuction.
Oh.
It could be something with like just a tummy tuck.
Okay.
Or it could be a combination of both liposuction and a tummy tuck.
Okay, I gotta pull out my question because someone asked me about liposuction. It's the one of the questions that I didn't get to put on my sheet. It came in too late.
Yeah.
This is a mom. I won't share her name, but she has, I want to say like a 6-year-old and then 4-year-old twins. So close babies, and then the twins are in there, and she's pretty petite. And she wants to know tummy tuck versus lipo, and then any skin tightening recommendations for post-baby skin flab and stretch marks, which I feel like we've kind of already talked about, the post-baby skin flab and stretch marks.
Well, so the reality is if somebody actually has stretch marks, if they have like a lot of tissue that you can grab, I don't think the money and investment of any of the non-surgicals is worth it. Because I don't think it's going to do anything.
It's not going to do anything.
I think the tummy tuck
is
the
miracle
answer.
creams that we're getting served.
None of those are going to help.
Okay.
I think if you can actually hold it, move it around, it's probably not going to do anything for you. And so I think someone that would ask this question, I think actually probably needs a tummy tuck. Like they know all the right words already. Like they're like, oh, I have this. Yeah. I think they're telling me.
Lipo?
Over lipo for sure. So liposuction is good for people that don't have a lot of loose skin. Liposuction is good. We're deflating a balloon. We're taking the fat out.
Got it.
And so if you have loose skin,
fat but not extra skin.
Correct. Because if you do have extra skin and we deflate you, now you're going to have more extra skin.
Got it. Okay, that makes a lot of sense. So this individual probably needs a tummy tuck.
The way I'm hearing the question, it sounds like it came from somebody.
We make jokes that we're going to come in for tummy tucks together and be like, hey, we're going to get some tummy tucks.
It literally sounds like someone knows that they need a tummy tuck and they just
want validation.
Yeah. They just need to hear
the
like
validation
yes.
you need.
Yeah.
And then while I have this up, someone asked about, is there any recommendation, a cream or other that would help with a keloid scar around a nipple after breast surgery?
Right. So actually, yes.
Okay.
And so, the things that have been scientifically shown to improve scars after surgery or injury of some kind are time. All scars will get better within a year. They remodel for about a year, which means the collagen that is scattered and not in a good place is trying to find their home and trying to like remodel to the right place.
Okay.
So one thing is time.
Okay.
The second thing is scar massage. So I have all my patients, I see patients after surgery at the 1 week mark and the 4 week mark, because at the 4 week mark, I want them to start massaging their scars. So they can use something like Lubriderm or Cetaphil, something very light that doesn't have any chemicals in it or minimal chemicals, and literally massage the scar up, down, side to side for 1 or 2 minutes at a time, 1 or 2 times a day, because that'll actually break down the scar.
Do you recommend this for all
Most of my
types
surgical scars.
Okay.
Like most, if not all.
Got it.
And then the last thing is anything that contains silicone. So silicone has been shown a couple times now to improve scar formation over time. So I have my patients wear scar tape, silicone gels, or silicone containing sunscreen for 3 to 6 months after the surgery, because it will help with the scar formation.
Wow.
Now, everything that I talked about is after surgery and up to about 6 months.
Okay.
After that time frame, I think we can start talking about things like lasering. If somebody has a true keloid, we can talk about injecting with steroids, other more aggressive managements. But I think the upfront thing
like
for
6
me
weeks to 6 months is where you
prevention.
kind of hit it. Yeah.
And
or
like,
4 weeks to 6 months.
I think of it as like trying to prevent bad
Yep.
scars. And you're going to massage them, you're going to give them time, and you're going to use silicone.
Yeah. Okay. Noted. I would not. I'm like thinking about like those silicone, I'm drawing a blank. My friend has a company, like those silicone patches that are like, I mean, they say to put them on stretch marks and stuff.
Oh, yeah.
But
so
like, is
very
that
similar.
like,
So anything that contains silicone. That's why I'm saying there's all sorts of stuff on the market now. There's very cheap silicone tape that you can buy on Amazon for like $20.
I was going to say they're on Amazon. You just peel off the little sheet and stick it on.
There's very expensive sunscreen that you can buy that has silicone in it.
Okay.
And then there's a bunch of stuff in between.
Okay.
I think as long as it has silicone, it's probably going to help you. It won't hurt you. All the other things that are the vitamin E's and all these other things that are not containing silicone, I don't know that they're going to do much for your scar.
Okay. And this would be for any scar, but you're saying up to 6 months. So after 6 months, we're not.
Up to 6 months, just give it time. And if you really need a revision, so for my own surgical patients, if it looks really bad, I will consider revising your scar, meaning redoing it at about 6 months. If it's just a little red or it's a little raised, we might laser it, and I will laser it myself. And if it's a true keloid, we can inject it with steroids.
Yeah. Okay. Noted. Buccal fat removal.
Buccal fat. Yeah.
Buccal fat. Mm-hmm. Wow. Okay. Is that still a thing? Are people asking for it?
I think it's a thing. Yes, it's a thing. And I think it's very reasonable to do in the right patient. And so this is the way I talk to patients about it. So I have a lot of, not a lot, but a good number of ethnic patients. And so an ethnic face tends to be a little rounder.
Okay.
And if you look at a person's grandmother and their grandmother died with a round face, this person is probably okay to have buccal fat removal to like narrow their face a little bit. And it's not going to harm them.
Yeah.
It's not going to harm them in the long run.
Yeah.
That's not the same.
That's like this right here, right?
Mm-hmm. It's like it's your cheek fat, essentially.
The Miley Cyrus, right?
But so I think she's a great example. I don't know for sure, but it looks to me like she's had the procedure done, and I would have never offered it to her because she is already a lean person. Mm-hmm. She has a leaner face, and now you're taking the fat away or the volume away from her face, and it's going to just simply accelerate her aging or make her look older than she is.
It did. I feel like she had a very youthful face.
Right.
And someone that I always look to whenever I want to like get crazy, which now, I mean, everyone wants like this thing right now, like the sharp cheekbones. But look at Miranda Kerr. Miranda Kerr has like a beautiful like round, and she still has like those baby-like cheeks like that.
She still has a fullness to her.
The fullness to her.
Yeah.
And it's very youthful.
It's very youthful. And so some patients, you want that fat.
Yeah.
Yeah. I think it's only okay to remove it in a select number of patients.
So when people are coming in, I think I already know your answer. People are coming into you, they ask you, hey, I want to do this. You're making an honest recommendation. You're saying, hey, I don't want to do that to your face. Like, do you turn people down?
All the time. I turn people away all the time.
Which I think is a sign of a really good
I try to give them... So most of the patients that come in to see me, I will say what's bothering you. Because the last thing I want to say is give you a complex or insecurity about something that I see that you haven't even noticed.
Yes.
So I will say like, what bothers you? And then we'll have a conversation about options. Some patients will come in with a list of wants, and they already say, they know that the extra skin on their belly bothers them, but they are like, I want a tummy tuck, I want liposuction, I want this, I want that. Other patients come in and like, this just bothers me, what do you think? In either scenario, I give them my recommendation of what I'm seeing. Mm-hmm. I make sure that their concerns are heard, that they feel seen.
Yeah.
And then I give them my recommendations. And then I sometimes say like, I don't know that this is worth it for you. I don't know that I can accomplish what you want. I don't know that this is a good look for you.
Yeah. And they're going to go to somebody else.
And they're welcome to go somewhere else.
And that's fine. But then your name's not on.
Correct. My name's not. They're not walking around with my name on them.
They're a billboard of your work, right?
Yeah. And I try to tell them like, listen, And I try to give them advice in the sense of like, if you look hard enough, someone's going to say yes. But I really just don't think this is a good idea.
That doesn't mean it's right. Just
It doesn't.
someone's going to take the money
just told
and
you,
do the thing.
I just don't think I'm not going to do this for you.
Yes. Yeah. Makes sense. Okay, I want to ask about Zerf because I know you're a big fan of the Zerf.
I'm a huge fan.
And it's funny because on a couple past guests that I had, they're not a fan of the Zerf or they're questionable about the Zerf. So I want to know why you like it, what it does, and what's your kind of recommendation with it.
So a couple of things. So the Zerf is a radio frequency machine, okay? And I think that radio frequency in general has gotten a bad reputation because of some of the other machines that were out before it that were melting the fat that was under your skin.
Okay. It's like the Morpheus?
The Morpheus.
Yeah, okay.
The Morpheus is what I'm talking about.
Yeah.
Yeah, it really didn't do that well.
No, yeah. It started off great, and then everyone's like, wait, we look a little crazy.
Yes, exactly. So the way the Morpheus worked, as an example, it had needles and it stamped you. So you had to put the device down on someone's skin. It would poke all these needles in you, and it would heat those needles. And so it provided some heat and an injury. The way the Zerf works, it's a topical or a wand-like device that you just put it on the skin, and then it rapidly heats and rapidly cools. And then you move to the next spot. Or you glide it. So like I'm a big fan of when I get it done, because I've had it done on my face and abdomen like 4 or 5 times.
Wow.
And I have them glide it because in the direction that I want the tissue to get pulled or lifted in over time.
Okay.
The way the Zerf works is it delivers radio frequency, which is heat, but it does it very, very quickly. And then immediately it spits out this cooling right after it. And the heat is going to be attracted to anything that has water in it. The superficial fat that people worry about has the least amount of water relative to the muscle, the skin, and the collagen. So those other structures, the muscle, the skin, the collagen, are going to absorb the heat before it really has time to set in the fat. Could you override the machine and could you make that heat pattern stay for longer and actually melt the fat? You could. But now you're using it off label and you're messing with the settings. It is such an easy device to use. You're not supposed to be messing around with these like other things. So in the right patient, I think it is great to provide a little bit of lift, provide some collagen production, and I think it works. The reason we got it is it was the number one device in Korea, which Korea has access to everything. So it had already been the number one device in Korea for over a year. We trialed it, and mind you, we will not buy something that we're not allowed to trial. We get somebody in our door trying to sell us a machine every single day of the week. But we will not buy something that we're not allowed to trial, and we won't buy anything that we don't see a result from.
Okay.
So I work with 2 female plastic surgeons. There's 5 of us.
Okay.
One of them was the guinea pig for the Zerf, and she was obsessed. And you can see a visible difference. You could see her before and her after.
On her body or her face or what?
On her jawline. Okay. Especially on her jawline. She was bothered by like a little bit of jowling, and it definitely made a difference.
Okay.
So we decided to get it. It has done extremely well. Every machine has a patient that's upset. Knock on wood, we haven't had a patient that's upset. The machine itself has done extremely well. The patients are happy. They're getting results. I think it kind of speaks for itself. I think it is a great device.
Okay, good. Interesting. Now I'm going to have to go back and listen to that. Why she didn't like, but that's a really good description. And it's totally non-invasive.
It's totally non-invasive.
It's just going on top of your skin.
It's just going on your skin, and there's no needles involved.
Okay.
And again, the idea is that the radio frequency or the heat is delivered so quickly that it's going to land only in the tissues that have a high water content.
Got it.
And the fat is going to have the least water content of the tissues around it. And they've done studies. They've done like pig studies and human studies to show that it doesn't destroy the fat.
With the machine?
Mm-hmm. With the machine. There are 2 ways to kill fat. One is to actually kill it, which is called necrosis, which you're killing, murdering the fat.
Okay.
And the other is to tell the fat cell to die, to induce death. They have done studies to show that it does neither. So it neither induces fat nor does it actually kill the fat cell. Some of the other devices did.
Interesting. Okay.
Yeah.
What was that thing that was popular for a little while? It was like kill the actual fat cells, like freeze them.
CoolSculpt. Yeah. I think it did okay for a little bit. I think we're past it.
We're past it. We're over it.
I think we're past it.
The M-Sculpt.
The M-Sculpt is different. The M-Sculpt is supposed to basically use magnetic waves to stimulate muscle and do some other stuff. I think that one's still around. It has maybe a little bit of promise. Not my favorite. We did not buy it. We haven't bought it.
Oh, okay.
But I think I don't think it's going to hurt you per se. The radio frequency that was invasive, I think that one did melt people's fat, and it had like consequences.
Okay, good to know. I haven't heard about it much. It was like super popular for a little while.
Oh,
all of those, like CoolScope, Emsculpt,
CoolScope was
Emcella.
super famous in like 2015.
Yeah.
It rode its wave.
Yeah, and we're on to on to Zerf now. We're on to other things. Okay, let's talk about breast implant illness.
Breast implant illness.
Breast implant yes, breast implant illness.
Sure.
I want to know your thoughts about it. I want to know where that comes from. I know there's so many different types of breast implants. Do you think it's just person to person? Some people's bodies reject a certain thing and other people's bodies is like, cool, you can put this foreign thing in here. What do you do when you encounter that?
There's so many things to talk about, but let's talk about a breast implant by definition is a foreign device to your body.
Yeah.
Okay, we create a pocket, we put the implant in, we close that pocket up. There's a couple of things that we all need to keep in mind. Everybody's technique is a little different to put that implant in. So in a perfect world, the implant never touched anything except your breast. It didn't really get handled by a bunch of people. It didn't it didn't touch a bunch of your breast tissue on the way in. In a perfect world, it was as clean and sterile as possible and then went in.
Okay.
And then you close up. Also in a perfect world, you didn't bleed a lot, you didn't create a lot of blood around it, and you didn't create an inflammatory response to the actual implant. So the idea behind the inflammatory response is if your body recognizes it as a foreign body, it's going to want to wall it off or create a capsule, like a rim of scar tissue around it. If you're really lucky, that capsule will stay nice and pliable and soft and allow your implant to live in there kind of undisturbed by what's going on.
Got it. Is that like the body's kind of like protecting the rest of the body from this
walling
thing?
It off.
Yeah, like you look hot, but we're going to protect
and we're gonna
the rest of ourselves.
Put this implant away for you here.
Yes, got it.
But if you have bad luck, that capsule gets really thick and it can cause problems. Okay. So that just is going to happen in some variation for anybody that has an implant of any kind.
Yeah.
Separate from that, and more recently, there's been many reports of women that come in that had breast implants put in that years later develop very vague symptoms like fatigue, hair loss, joint pain. And it's not any one symptom. It's a bunch of various things, brain fog. So all these kind of vague things, it could be caused by anything, that then go on to have their breast implants removed and they feel better.
Yeah.
And so I think there is something to that because I think there is a possibility that your body is having a long-term low-grade inflammatory response, meaning you're able to function day to day. You wake up, you go to work, but you have sort of like an inflammatory response to the implant. And I think that's maybe bad luck. Maybe it was surgical technique. Maybe it was a shell of the implant. And there's all these questions on like what's causing it.
Yeah.
But I do believe it's real. It's not going to be in most people. It's a very small portion of the population. Other talks about it are around autoimmune diseases. So things like lupus, rheumatoid arthritis. There is some thought that, if somebody gets an implant at 20 and then they develop rheumatoid arthritis at like 30, 35, which is around the time that those things start to happen, people wanted to blame the implant, but the reality is like that's around the age when it would have happened anyway. And so there's this correlation, but no one's been able to prove a direct link from the implant to some of these other issues.
Yeah.
But I do believe that there is some possibility that these symptoms could be related to a low-grade inflammatory response.
Yeah.
And I think that response could be due to the implant shell, to the technique with which it was placed, or just to your own body.
Yeah. I really appreciate you saying that because I've heard, in my research I do, people are like, nope, 0%, it's not. And I'm like, well, that's a little unfair because I think not just implant, but you could put anything random in your body that's a foreign thing. Your body's going to have some sort of response to it. Some people will have a histamine response to certain foods. Like you can't tell me that it's not going to have a response to a foreign object. And I've never heard about it spoken, though, about the procedure in which it's put in there. So that's actually really interesting. So how does is that just like the doctor that you choose? Like luck of the draw? You just got to pick a really good doctor?
Correct. Because it's hard to say. You can't. I've never had a patient ask me, like, do you use a funnel? So a funnel think of like a baking funnel, like for frosting.
Yeah.
That's the way we put the implant in. So the implant goes from its little container into this funnel. And then at the bottom of the funnel, it's narrow, and we put that little end into the pocket, and we squeeze the implant in there. So technically, I never touched it. Your breast tissue never touched it. It just went in. Not all surgeons use it. Yeah. So if somebody literally manhandles the implant and then shoves it in there, that implant is being traumatized because it's being shoved. It's touching all the breast gland, which is essentially the breast is a giant sweat gland.
Yeah. Yeah.
It's touching your skin,
Yep.
which no matter how much betadine we use, you're not going to kill every single bacteria on there.
Totally. Yeah.
And so I think it does depend a little, there is a role that surgical technique plays.
Yeah. Well, and you know what I think it's like with anything too? I say this about C-sections, which I'm so not anti-C-section. I intended to do an elected C-section for my third baby because I'm just get her out and I want to get home. I want to look glam and like I want to be able to schedule this. I have 2 other babies. And then I kind of was doing my own research that like it's not, there are not zero, like you're told there's zero risk, but there are actually
No,
risks.
anything we do has a risk.
Anything you do has a risk. And so I think it should be up to us as women to decide. Like, yeah, I want to understand the risk. And someone might be like, you know what? Cool. I picked this doctor. I feel super good about it. If I cross paths with issues, then maybe I have to figure it out later,
And that's, honestly, as part of my talk with patients when I consult with them is I say things like that. I say like, listen, we don't know how your body's going to react to this, but lucky for you, I'm not going anywhere.
Yeah.
And so if you do develop an issue, I will be here.
Yeah.
And we can, at that point, address whatever's going on together.
Totally. And with the scar as well. It's like, you don't know how your body's going to scar.
No.
It might look crazy or it might heal super well. It's like
you just don't know.
You just literally don't know.
The other thing about the implants is, there's this new implant out, the Motiva.
Yes. I've been reading about the Motiva.
I'm obsessed.
You are?
The reason I'm obsessed, I went to visit their labs in Costa Rica.
Okay. Love that.
And so the implants that we are using now are what we call smooth, or the shell of it is just like smooth silicone. That's it. Those were designed because we knew that textured implants were bad. And so we went from textured to smooth. Okay. Texture just means it's rough.
Okay.
That's all. The Motiva people truly took the time to be very intentional about why they were creating what they call a microtexture. And so it's going to sound really nerdy, but the way that it was shown is that their shell is very, very tiny, tiny texturing that's perfectly placed so that the cells that we know that produce collagen, the fibroblasts, can't adhere. And if they do adhere, can't hold hands with the next fibroblast. That creates all these peaks and valleys so that the cells that cause the issue can never really...
We're trying to encapsulate you, but we cannot.
They can't reach each other and they can't latch on. It creates all these craters and peaks and valleys, and so it doesn't allow for the attachment.
Yeah.
So the smooth ones allow for attachment, and the old textured implants used to allow for the attachments because there was so much space.
Got it.
And these are so well done that I think really... It's the reason that their rates of complications have been shown to be so low.
Did they create this purely on the basis of that exact reason? Like, did they create it saying, okay, we know that this kind of like these little cells are trying to hold hands, so we're going to make something that's why they made it?
Correct. And I think it's the first company that's ever intentionally made the shell the way it is.
Yeah.
Yeah. They really, I think, sat down, thought about it. And they have some very smart PhD people that can answer all the questions.
I love that.
And they truly, I think, are like the first implant that's intentionally made a certain way.
So if I ever decided to go implant,
and Motiva. For sure.
It's
like
Motiva.
Right now, that's the implant that I'm using for most of my patients.
Significantly more expensive?
It's a little more expensive. It's not. Okay. It's not double,
but worth it.
Yeah, it's not double.
You're gonna put it in your body.
No. Like, but I do think you're getting a better product.
Okay, cool. Downtime. I feel like I could ask you so many questions. I could sit here all day. Downtime for all of this stuff.
Mm-hmm. So breast implants. Let's start there.
Okay.
If you have just an augmentation, which means just implant placement, nothing else, no lift, I let you go back to doing almost everything at 1 week.
Wow.
You'd have to take it easy for a week.
Okay.
But after 1 week, you can do single joint exercises.
Nice. Okay, great.
But nothing that involves your chest and nothing overhead.
Okay. What about the breast lift?
4 weeks.
Okay.
Because you have more scars, because there's more room for... If the problem with aggressive activity after a bigger surgery is you can cause bleeding and swelling. And so if your heart rate goes up, if you're sweating, you can cause bleeding and swelling, and you don't want either of those.
Got it.
Yeah.
Okay.
You're not going to particularly mess up the result, but you don't want to cause bleeding or swelling.
Yeah. Okay. Tummy tuck.
6 weeks. So I'll tell you why.
Okay.
6 weeks. The chances you break open the incision are almost zero. They're very, very low.
Okay.
But the chances that you break open the corset suturing or the sutures that we put on the inside to bring your six-pack muscles back together, you can pop those.
Oh my God.
And if you pop those, you'll know. Like you'll hear a pop and then you'll look round again.
And you got to go back in there?
And you have to go back. There's the only way to fix it is to go back in there.
Okay.
And so 6 weeks is a hard and fast rule of no pushing, no pulling, no lifting greater than 10 pounds, for 6 weeks.
Wow. Okay. Not like a bed rest situation.
No, not like a
just
breast. No pushing, no pulling greater than
Okay.
10 pounds. And I operate on a ton of moms.
Yeah.
So sometimes the kids are like under 2. And I'll
Yeah.
tell them like, well, for 6 weeks, you can have the kid come sit on your lap.
Yeah.
But you shouldn't
But
be
you're
the
not
one
picking
picking them
up
up.
and-
Same thing into the car. Like take a little more time and let them crawl themselves into their seat. But don't be the one that's picking them up from the ground and putting them in their car seat.
Yeah. And then what about a facelift? Just because I'm on the
A
topic.
facelift, I say the following. I say at 2 weeks, everybody swells and bruises a little different. But I say in general, at 2 weeks, someone in the grocery store or the bank should not know that you had anything done. A stranger that doesn't know you should not know that you had anything done.
Wow.
To someone that sees you every day, you may look a little puffy, you may look a little shiny just from the swelling.
Okay.
But someone that doesn't know you shouldn't know and you should be able to wear makeup at 2 weeks.
Easy. Okay.
At 4 weeks, you should just look refreshed and no one should really know that
Everybody.
you had anything done.
You just look.
You should just look
You
refreshed.
just look refreshed. Do you think? Do you think most? Well, because I'm just thinking about Kris Jenner and her whole transformation. But do you think most celebrities are getting plastic surgery and then just not saying anything? Because they'll all be like, I think everyone's
doing something.
I think a lot of people do Botox. I'm like, okay, but then are you getting
the thing with
snatched?
celebrities that we have to all keep in mind is also they're not doing one thing.
They're doing all
So
the
like
things?
if you think of Kris Jenner, I think she has an amazing result. Let's start
Yeah,
there. I think she's like, she went to an amazing surgeon. I think she has a great result.
Mm-hmm.
I am almost sure that she probably also went to hyperbaric oxygen treatment to help with the wound healing.
Yes.
I'm almost sure she had some sort of skin resurfacing, a peel or a laser of some kind
Mm-hmm.
to help the quality and health of her skin. I'm sure she gets medical grade skincare and facials.
Totally.
And during her recovery period, she was probably on a high protein diet that someone helped design for her.
Yeah.
So like she was doing all the things.
Ayurvedic, all the things.
And so when I see patients and they ask me like, what else can I do? I give them a list and I'm like, these are all the things you can do. But then I also have patients that are like, what is the one thing I can do to make myself look better? It's like, well, there isn't one thing. I mean, no one machine is God.
These people are doing all the things.
These people are doing all the things.
They're layering things. It's internal. It's external.
Totally.
Okay, so last thought, skincare. Let's talk skincare.
Talk skincare. So skincare, I think, is one of the most important, if not the most important thing that you can do for your skin, for your facial aging,
Okay.
and for your health in general. I have a lot of friends, male, female, who ask me what they can do, and I'll be like, or what laser they should get. I was like, well, what are you using for skincare? And they're like, oh, nothing. I don't even wash my face. And I was like, listen, if you can't even commit to a couple of products in the morning,
Yeah.
this laser is not going to save you.
We're not lasering you.
Yeah. Like this isn't going to save you.
Yeah.
How can I believe that you're going to follow the post-op protocol, which includes a bunch of ointments, if you can't even use medical grade soap?
Yeah.
Like, let's start there. And so here, I actually brought you some stuff.
Okay. Oh my gosh, I'm so excited.
So hold on, let me go through this.
Okay.
Some of these are just fun, and some of them are like true things that I believe everybody should be on in some way.
Okay. I just turned 35, so it's I feel like I'm kind of like
35.
going this way.
So one of the companies that we offer products from all different companies, and I mean that by like the fillers, the neurotoxins, and the skincare,
okay.
because we believe that every company has something to offer for different purposes.
Okay.
But one of the companies that I really like is called Skin Better Science.
Ooh, yes.
Skin Better Science,
Okay.
I think, has taken the time to really try to understand the benefits of the stuff they're putting in here
Okay.
without the additives.
Oh,
And so I think that's really important because it doesn't have the
Yes.
perfumes, it doesn't have the fragrance or the color.
very important.
If it doesn't need to be in there. They're
Yes.
just minimizing it to the scientific components that are going to benefit you.
Okay, great.
I also think they're very thoughtful about using the molecule has to be a certain size for it to absorb. If it's too big, you can rub it on your face all you want.
And it's just
not,
sitting
It's
there,
just sitting
right?
there. It's not going to go
Yes.
anywhere.
Okay.
And so I think they're very thoughtful about what goes in each product.
Wow. Okay,
So
good to know.
this one, hold on. This one. The tree, there's
You got
serums.
so many goodies
Oh, yeah.
in there.
There's so many. So they make a moisturizer that I think is the best moisturizer. It's called the Trio.
Okay.
And then they make all these other products that I think all help. There's
Okay.
a serum. There's a Retin-A. I think everyone needs to be on some sort of Retin-A because it's been shown to help your cells turn over better and improve pigment, improve wrinkles, and improve collagen production over time. So my number one thing that's medical is to tell patients you should be on some sort of retinol or tretinoin.
Okay.
And you should only be wearing it at night because it can make you sun sensitive.
Okay.
You should wash it off in the morning. There's all these things that I tell patients that I don't
Okay.
think every place does. Sometimes I think they just hand you this thing. And they're like,
here, get
good luck.
after it. Yeah, enjoy.
The other thing is a sunscreen. I think everybody needs to be on some sort of a medical grade sunscreen because
this is where I fail. I don't.
Well, why don't you? Is it because of the tint?
You probably might think I'm crazy, but I just feel like the sun has so many good benefits for you as well.
So it does help your vitamin D production.
But I put a hat, like I'll sit in the shade, which I know everyone's going to say, it still gets you in the shade. So I don't know. It's just not ever been a like super big focus for me.
It protects your skin so the sun tells your, damages the DNA in your skin. And that's been shown many, many times. Okay. And so sunscreen at least I think protects you from the UV damage or the DNA changes in the skin. Yeah. Now, I think the hat is a great option because it's not going to then tan you. It's not going to create all this other damage. Mm-hmm. But you should be wearing some sort of medical grade skincare, sunscreen. I know. The reason I asked you about the tint is I think many companies offer some tint, and for someone of ethnic descent, it's never the right tint.
No, never.
You know what I'm talking about? Like, it always
like a little powder doll or something. Yeah.
But I think if you look around, you'll eventually find one. A lot of the companies are now making what they call a clear. So it's supposed to go on clear, and I like those. Yeah. I think you can put makeup on over it. Yeah. That's your issue. But I think you should be wearing some sort of sunscreen.
I check my app and it's like UV10. I'm like, let's get out there.
UV10?
It's like UV8, whatever. It was really high the other day.
So this was one of the sunscreens. You should try that.
Okay. So I'm going to start this. This is the Sun Better Tone Smart. Wow. SPF 75.
Yeah. Listen, summer's here.
Summer is here. And we all know I'm outside. You see my videos. I'm out.
And then the Alpha Ret is the retinol containing product.
Okay.
I think this is good at night. Okay. I think everybody should be on something. Okay. You should start slow, like maybe one time a week, and then twice a week, and then 3 times a week. Is it going to make
me peely?
It makes you peely if you wear it too much. Okay. And it also makes you sun sensitive. So I tell everybody wash it off in the morning.
Got it.
Like don't just walk outside.
Yeah. Okay, so cool. That. So I have never used a retinol before, or retin-A.
Really?
Yeah, never. No, never.
Oh, well, I'm glad I came.
I am the person who it's very, I'm like, I want a good wash, and then like maybe a serum, and I'm going to go about my day.
Here's the serum.
Okay, cool.
Now that you said that.
But now that I'm getting a little older up there, I got to like crank up my game.
And here's another serum.
So this is...
And then there's a facial kit in here, but this is more like fun.
I'm going to link all of this up in the show notes as well, and I'll do a little recap on that. Okay, so Defense and Repair Serum. Okay, noted. And then that's the Active Balance.
See, this one's supposed to balance like the pH of your skin and help overall the health of your skin.
Okay, good. See, I need all this. Okay, all of these will be in the show notes.
Everybody should be on...
And do you guys have these at your...
Yes, and actually... for our practice, our Instagram account has like the companies that we are affiliated with, and you can buy directly from them.
Okay, great. Yeah. I love it. But this is your favorite.
This is my favorite. This is my favorite.
Jam.
The only thing else, the only thing that I didn't bring that I use every day is the Ulta MD Clear sunscreen. That's the sunscreen I use.
Okay, got it.
But otherwise, I use their face soap, their moisture, and
your skin looks amazing.
And they make this men's product that has like vitamin C and other stuff that I like.
Let me get that from my husband.
It's called Men's Solo Defense.
Men's Solo Defense, and then Ulta MD.
Ulta MD Clear.
Okay. Ulta MD Clear. Okay, I'm gonna link all this up in the show notes for everybody. Okay, this was so fun.
Yeah.
Now, round 2. I'm coming in for my consultation.
Listen, we're always here.
Okay.
You let me know.
I need the boob lift. I need the tummy tuck. I think I need the tummy tuck more than I need the boob lift, but I need both. And I need the Zerf, maybe.
You would love the Zerf.
Okay.
So I actually consider the Zerf. So there's 2 things that if somebody says, what can I do as a red carpet or a party ready treatment? Yeah. It would be the Zerf.
Okay.
And on the same day, a hydrofacial.
Oh, wow.
So those 2 things will make you glowy.
Okay.
It'll make you glowy. It'll clean your skin. I've had now more than one patient that just sees me for other stuff that I recommend this to, that they do it before their 50th birthday or their 45th birthday party. Like they'll come in on the Friday, get the Zerf and the hydrofacial, and now they're set for their party.
So 1 session of Zerf, and you're
supposed to do 2. So the treatment plan is 2 4 weeks apart from each other. But it does give you a glow that I think is helpful if you're going to go to an event, or if you're going to go on a trip, if you're going to go to a wedding. Yeah. So I think if you can time it around that, my ideal for a red carpet prep would be a Zerf and a hydrofacial on the same day.
Okay, I'm so happy you said that, because I had like a minor freak out. And again, like I'm a very natural gal, and I'm so risk adverse. But a couple months ago, I was going out to Texas for South by Southwest to launch my company. And I was like looking at my face. I'm like, I look a little saggy and dry. And I text a friend. I'm like, should I do the Botox? Like, should I just do it? She's like, no, you shouldn't. You're going to hate it. And I'm like, but what do? I don't know what else I can do.
So
So now it's that.
The Zerf is just it's not a product.
Yeah,
It's like a device. It'll just kind of tighten you up a little bit.
And then get a little hydrated.
And then get hydrated. They're just cleaning your pores and hydrating your face.
Yeah. And you look
glowy.
Glowy and snatched. Okay. See, that's going to be the move.
So as a guy, before I go on a trip, in the last year or so, have been doing a Zerf to my abdomen and to my face.
Okay.
I get laser hair removal. I get a hydrofacial.
Love it.
And I do get Botox. So I'll get Botox, my touch-up if it's time. But those are the things that I do before I go on a trip.
Forehead or what?
Forehead, glabella, and then my crow's feet.
Oh, okay. Okay.
And those are the things that I do before I go on a big trip.
That's your glow up.
Yeah.
That's your...
So I'm going to Europe in the summer. I already have like the appointments made in the spa. Like on this day, this is what I'm getting.
In order. Yeah. I'm like spray tan, nails, lashes,
See,
like that type of stuff.
But now this is just like medical grade.
Yeah, medical grade.
Yeah, you're just like one more step up.
Here's the thing. We have a trip in Tulum in the fall for our friend's 40th birthday. And I'm like, I have to get a tummy tuck before and a boob lift before that. So that's on my list.
So it's either you're pregnant then,
or
you're...
I'm like, either we're pregnant and we don't go, or I'm getting it. Because I don't want to be pregnant at 36, candidly. That's just, my kids are so little. I feel like I don't really want to be pregnant at 36. And so
you probably, if you're going to go on a trip, and I tell this to my patients too, is you probably want to give yourself 12 weeks from the date of the trip.
Okay.
It's 6 weeks of no pushing, pulling, but you're going to be swollen. And so you probably want 8 weeks for 80. I tell everybody else also, 80% of swelling goes away at 8 weeks.
Okay.
So you want that swelling to go away. You want to feel yourself. You want to be back in Pilates if you do Pilates. You want to be back in yoga if you're doing yoga. So when you go on your trip, you don't want to just be recovered. You want to be back to your baseline.
Yeah. That's true too, because I got to be able to work out and like...
Yeah, all the things.
Tone my booty and stuff too. Okay, so phase 2, coming in. We're going to do all that stuff. I'm so excited. Thank you so much. This was incredible. I love a person who's just like extremely above average. Everything you just talked about, because I've done research on this stuff and I didn't know half of the stuff that you just taught us. So this is super exciting. Thank you so much for being here today.
Thank you for the opportunity. This is great.
Yeah, this is awesome. Where can everybody find you?
Everybody can find me on Instagram. I'll give you a link and then you can attach it.
Perfect. We'll put you in the show notes.
Yeah, thank you.
Yep.
And then obviously our South Bay Plastic Surgeons also has an Instagram that you can follow.
Cool.
We're on YouTube. We have a website.
Yeah, love it. Okay, thank you so much for being here today. Yeah, thanks everybody. See you on the next one.